Spending. Knowing your finances will help your decision-making abilities and help you be an effective supporter of your child. It will give you a clear understanding of what you can and cannot afford and how much credit you have available. In this module, you'll calculate your cash flow, or amount of money you have, by listing your income and expenses. You will also learn different ways to lower your spending and increase your income or savings. List income. After you have your documents organized, it's time to use the List Income handout. On this handout, write down your current monthly income in the first column. You can also write any income or money that you can reasonably expect to get that is related to your child's disability. This may include government health care assistance or gifts of money from the community, civic, or religious organizations. How to handle reimbursements. You might get some money back, also called a reimbursement, for some of your child's medical costs from a healthcare provider. Reimbursements are not income, but they are a kind of payment for medical care that make up for real costs. You should include medical reimbursement amounts and the actual cost amounts in your spending plan. This will help you keep track of how you spend your money, even though the reimbursements make up for the actual cost. How to handle temporary or periodic income. Documenting temporary or periodic income can be challenging. Workers' compensation is an example of temporary income. Money from family or friends is an example of periodic income. The purpose of a spending plan is to see what is happening right now in your finances. If you include periodic or temporary income, you might overstate your monthly income for some months. List expenses. Now it's time to use the List Expenses handout. On this handout, write down your current monthly expenses in the first column. For monthly expense amounts that change every month, like utilities, use an average monthly amount. For periodic expenses, such as auto insurance premiums, spread the expense amount over the service period. For example, if your insurance premium due is $600 every 6 months, divide 600 by 6 months for a monthly expense of $100. For items you purchase on credit, such as a piece of assistive technology equipment for $6,000, adjust your spending plan to show how much you'll spend each month to pay it off. You may have to account for interest expenses on unpaid balances. For items you purchase for cash from your savings account, such as travel or entertainment items, adjust your spending plan to show how much you'll save each month to build your savings back up. For anticipated expenses you might come across while caring for your child, there is no easy answer. You may have to purchase or replace assistive technology devices or pay for new services. Talk with professionals, your caseworker, and other parents familiar with your child's disability to get a feel for what types of costs you may have, their estimated costs, and any lower cost options. Calculate cash flow. Now we will use the cash flow handout to figure out your cash flow. Write your total monthly income from the List Income handout and your expenses from the List Expenses handout. Subtract your monthly expenses from your monthly income to calculate your cash flow. Do you have money left over each month after paying your expenses? If you do, you have a positive cash flow, which is a great thing. If not, you have a negative cash flow, and there are ways to help you fix it. The best thing you can do is to lower your expenses. You can also add to your income or do a combination of both. Lowering your expenses is often the easiest thing to do. Strategies for reducing your expenses. Many expenses related to your child's disability are not covered by healthcare plans. As your child's needs change, the related costs can increase. This can make it challenging to continue paying for your child's needs. If your child gets support through government healthcare assistance programs, you can contact your case manager to learn more about what resources might be available to help pay for those items. You can also contact a local parent center or support group to speak with someone about possible funding sources for these related costs. Contact a disability-specific organization to ask about funding sources. Examples of disability-specific organizations are Spina Bifida Association, United Cerebral Palsy, or the Autism Society. Additional ways to lower expenses. One way to lower your expenses is to connect with other parents. You can learn new ideas on how to save money for treatments, therapies, services, and assistive technologies. You can connect with other parents through a local parent center or support groups for parents and families of children with your child's specific disability. Look for funding sources. In addition to making connections with other parents, you might find some funding sources such as foundations, government agencies, and financial, academic, and medical organizations that offer supports like grants, low-cost loans, and other funding tools for many different needs related to your child's disability. You can ask your disability-specific organization or a local parent center for ideas about where to find possible support. Compare rates, fees, and premiums. After looking for some funding sources, you might do some searching for lower home and auto loan rates, credit card rates and fees, bank fees, and auto and health insurance premiums. If you find a lower home rate, you can apply to refinance your loan to lower your interest rate. If you find a lower bank fee, you can switch banks. If you find lower auto or health insurance premiums, then switch insurance companies. Make sure you ask about any fees that you might have before switching between any companies. Examine your bills for errors. Another way that you might save money is to check your bills for any mistakes. Billing mistakes can happen, even with automated systems. If you think there is a mistake on a bill, you can ask your healthcare provider for an itemized bill for further review. Other cost reduction tips. Some other ideas to help you reduce your expenses include: make a grocery list from a pre-planned menu and stick to it. Buy store brands, compare prices, and look for weekly store specials. Clip coupons and use a store membership card. Shop the sales and stock up on items you use regularly. Learn new recipes that have simple, readily available ingredients. Strategies for increasing your income. It can be a challenge for parents of children with special needs to find ways to increase their income. It may not be practical to find a second job or to work overtime because your child might require a high level of care. Searching for a job can be difficult. One of the biggest concerns in any job search is employee health care benefits, as well as finding an employer who would be willing to be flexible when you need time off for emergency care or doctor visits for your child. It might be beneficial to work with a job search agency to help you find a job with health care benefits that you want and need. Some other ways you can increase your income include asking for a raise, finding a higher paying job, working overtime, getting a second job or part-time job, providing a needed service in your community for pay, such as babysitting, dog walking, snow shoveling, and tutoring. Participating in a research study for pay at a hospital or university, selling unused household items at a garage sale or through an online auction. Starting a savings habit. Saving money is a good habit to have. If you haven't already started a savings habit of some kind, now is the time to start. The habit of saving is more important than the amount you save because small amounts can add up over time. A strategy to start saving is to pay yourself. Each month, put aside a small amount. If you treat savings like a bill, you can put small amounts into a savings account on a monthly basis. You can also save loose change, as well as additional income, such as work bonuses or tax returns. Another method of savings is to use jars or envelopes for categories such as holidays, vacation, spending, saving, and any other event you may want to save for. Emergency savings. It is important to have a savings account of some kind in case of an emergency. It is better to be prepared and plan an emergency fund ahead of time than to be in financial trouble after an emergency happens. As you are building your emergency savings account, there might be times when it's tempting to use the money for other things such as bills, shopping, or even a vacation. It will help you and your family to make a list of things that it is okay to use the money for. This will help make sure that you are using the money for true emergencies. An emergency savings account can help prevent you from adding any debt or struggling to come up with the money quickly. You want to be sure that your emergency money is there when you need it.